Hi, my name is Diego Hernandez. I am a board-certified vascular surgeon who specializes in the care of vein conditions. Today we're going to talk a little bit about varicose veins and the most recent technology to help you treat these veins. So varicose veins are a very common problem. It is estimated that in the United States, half of the women in this country and about a quarter of the men in this country have a problem with varicose veins. What exactly are varicose veins? Well, veins that are coming up to the surface of the skin that are large and can sometimes produce symptoms are what we term varicose veins. Typically speaking, those symptoms tend to be restless legs, heavy and tired legs, achiness. Sometimes things get worse with standing. Elevation seems to make a difference for patients, but it does seem to affect people's lives. In some cases, varicose veins can be associated with swelling, and in very, very rare cases, we can have complications such as bleeding or ulcers that can develop as a result of varicose veins. So veins in the legs are a little different from the veins everywhere else in the body. In order to get the blood back towards the heart, the veins are basically relying on a system of gates or valves that open every time that we take a breath in. In essence, by doing that, the body, in a sense, sucks the blood up towards our chest. The valve is then supposed to close to prevent the blood from going backwards. In cases where we start to notice people having varicose veins, we know that the valves are failing. They fail for different reasons, but the end result is that as the valves fail, it allows more blood to go towards the feet, which can cause the symptoms that people are experiencing. Vein blood will travel in the path of least resistance. So as the blood travels backwards, it will tend to concentrate on the surface veins. As the surface veins see more blood flow, they tend to get larger. When they get larger, they get noticeable. We believe that when the veins are stretching, that stretch is what causes the symptoms that people tend to experience, that heaviness, that achiness, that seems to become more and more bothersome. The only certainty in regards to vein problems is that the problem is progressive. There is nothing that can be done to reverse the effect that those valves have once the valves fail. So the best that we can hope for is to help you manage the symptoms, at least initially. Typically, we ask you to wear compression stockings, elevate the legs as much as possible. Occasionally, you may need to take some medication to help the discomfort, but those are all transient measures. In essence, we're just kind of putting a Band-Aid on the problem. So in this case, what we can now do is actually help you feel better and reduce the unsightliness of those varicose veins. How do we do that? Well, first of all, we have to evaluate you. We have a comprehensive state-of-the-art facility where we will do a special ultrasound, and we're going to look at your veins very carefully. We're going to determine if your symptoms are associated with vein disease, and if they are, then you and I can have a conversation regarding what the next steps are. Typically speaking, all the treatments for varicose veins are minimally invasive, and they can be performed here in my outpatient-based center in a state-of-the-art facility. We have access to the latest catheters that will allow us to treat your veins. We also have access to therapies that don't involve any catheters. These are the most up-to-date procedures that can be done, in essence, to help you feel better when it comes to the care of your veins. Now, vein disease can be a very complex problem. You may have seen some commercials on TV, have listened to some radio commercials, have even seen advertisements from other physicians that promise you that they can take care of your veins. Most of these physicians are not board-certified vascular surgeons, and the vascular surgeons are the only specialty that actually gets trained to take care of vein disease. So they mention that they have board-certified physicians, but often these physicians are not even surgeons. The care of your varicose veins should not be left to chance. The trust that you have on your surgeon is of paramount importance to ensuring that you have a good outcome. You do not want to go through an unnecessary procedure. If you have a board-certified physician that is not a specialist in vein disease, they can often do unnecessary procedures, and the result of that is years of potential problems. So don't trust anybody for the care of your varicose veins. Trust Bloomfield Vein. We're specialists in this care. We have our entire staff dedicated to your care, and we are the facility in Southeast Michigan that is state-of-the-art that can offer you anything that you want for the care of your veins.